Hello, everyone. Welcome to yet another live at ParentTune. Today's session is going to be super interesting because, as new parents, all your queries and doubts about the 6th week vaccination are going to be resolved. As a parent, I recall and relate that it is an exciting as well as an overwhelming phase with many first time experiences. One such important milestone in the journey of parenthood is to provide protection to the newborn baby through vaccines at the right time. That's why when it comes to their first vaccination post discharge, ensure that you call all the right shots and are armed with your best preparation. So today we have Dr. Hargovind Singh Bhasin with us to answer all our queries related to newer one vaccine to protect against 6 diseases, which we perceive are is a lesser painful vaccine, so that we feel fully empowered on protection decision through vaccination. So welcome, doctor.
Hello, good afternoon, everybody. I'm Dr. Bhasin from Jaipur. I'm Dr. Bhasin is a senior consultant in Surya Hospital, Jaipur. So I'll try to make everything clear to you about the various vaccines, or particularly the 6-in-1 vaccine, which is the topic of the day. And any questions, if it is there, you may ask about this vaccine so I can clear all doubts which you have in your mind.
Sure. Parents, let me tell you, Dr. H.S. Bhasin is a well known pediatrician in Jaipur. He practices at Dr. H.S. Bhasin's clinic in Raja Park Colony. He has over 38 years of experience in this field. Some of the services provided by him are, newborn jaundice, limping child, congenital disorders, evaluation treatment, learning disability, dyslexia treatment, newborn care, genetic diseases, nutritional assessment, lower upper respiratory tract infection treatment, viral fever treatment, rickets, diabetes in children, childhood infections, patient counseling, growth and development evaluation and management, people skills, pediatric critical care, development assessments, vaccinations, investigations, hospitalization, etc. So, doctor, most of the terminology may be new for our parents. So, I would want you to start with, could you please help us understand in detail that should parents choose standalone vaccines or the combination vaccines?
Right. In my opinion, the painless vaccines and a combination vaccine should be used. And with a one shot, one is able to get rid of 6 diseases. And particularly, it's a preferable that if we get a pre-made vaccine of 6 diseases like diphtheria, tetanus, pertussis. Pertussis is a whooping cough, kali khansi, and hepatitis B, poliomyelitis, Haemophilus influenzae. These are the 6 diseases which we can cover with one shot. And we should prefer a vaccine which is which comes in a prepared solution. So, and preferably it is in a pre-filled syringe. So we don't have to reconstitute it, and there should a less of spillage of the vaccine, and a proper dose goes into the baby. And give, of course, with that only, it gives a better protection. And this vaccine is given all over the world, in the most parts of the world, particularly all European countries, Canada, America, and so on. And in India, this is available for last many years. And this vaccine, I believe, is a better vaccine in as compared to the other vaccines. Now, there may be one question that it should be a painless vaccine or a vaccine with a pain. And I assure you that this vaccine does not cause any fever or any painful nodule on the site of the injection. And if at all one gets a fever, it is very mild, or child may be little jittery, might let cry for a day or even for a few hours only, but normally it does not cause any fever.
Sure. So, doctor, what are combination vaccines? This one vaccine to protect against six diseases.
Combination vaccines, as the word denotes, is a combination of various vaccines in one shot. Like here, if we have six diseases, there are three diseases like DPT is three, then tetraxine is also there for four diseases, then pentaxine is also for five diseases. Then the most advanced is hexaxine, which contains protection, gives the protection against the six diseases. So this is a combination vaccine, and it comes in a single dose vaccine against the six diseases.
Sure. So, which all diseases are covered under, covered by one vaccine to protect against six diseases?
This vaccine, which is six in one, it protects against diphtheria, galghontu, the people who call it in Hindi, tetanus, as a very well-known disease to everybody, pertussis, whooping cough, or we can call it a barking cough or kukar khansi. Then hepatitis B, which causes the jaundice and the liver damage, which may later on cause cirrhosis and a death to the patient. Then poliomyelitis, a very serious disorder, and it is usually, if it happens to any patient, if so anybody is suffering from poliomyelitis, then there is particularly no treatment except you have to live with it, and just only some physiotherapy can help a little bit and not more than that. Then hemophilus influenzae, this is a bacteria which causes upper respiratory tract infections, ear infections, and pneumonias. So if we combine all these vaccines for these diseases, we call it a combination vaccine of six diseases. Hexaxim, as the word denotes, hexa means six. Six diseases are protected by this vaccine.
So surely it protects our children, our child with, it covers all the six diseases, this one vaccine itself. So, doctor, I remember very clearly when I took my baby for DTP vaccination, my doctor explained to me about two types of DTP vaccines. So, for the parents who are watching us right now, I would request you, could you please help them know more about these vaccinations?
Yes, there are various kinds of vaccines available right in the market. Like if we go to the vaccines like triple vaccine, DPT, diphtheria, pertussis, tetanus. Okay, and this causes a fever. This causes a lot of pain to the baby. This makes a nodule on the thigh or the site wherever one gives. Normally, we give a thigh before 1 year of age, and you cannot do any massage. You just cannot pick up the baby, and the baby will be crying whole night for 2 days, 3 days, or 4 days, even more than that sometimes. So then other vaccines, like if you combine Haemophilus influenzae vaccine, separate vaccine is available. Then poliomyelitis injectable is also available in a separate one. So if we don't use combination of vaccines, then DTP, then hepatitis B, then Haemophilus influenzae 3, polio 4. Minimum you get 4 injections if you want to take a painful vaccination. Of course, cost may be little low, but harm is more than the cost. And if both are working, mother and father of the baby are working, naturally they have to take leave from their work. So there is a loss of manpower, and there is a impatience in the patient and a pain to the family, whole family, ranging from brothers, sisters, siblings, fathers, grandfathers, and all that. Whole family is involved while the child is crying. So to remove these sort of things, we should go for painless vaccine which contains the six diseases protection.
And definitely seeing the child in pain, causes a lot of pain, even a lot of pain to the parents themselves. So
Yeah, of
there
course.
is a question coming from a parent named Sakshi who wishes to know which vaccine is administered during the 6th week vaccination and what diseases does it protect my newborn against.
The After discharge, the first vaccine is given at the age of 6 weeks. At the 6 weeks, we have to give these three vaccines. One is the hexaxin. Hexaxin, which contains the sick diseases, against the sick diseases, diphtheria, tetanus, pertussis, hepatitis B, polio, Haemophilus influenzae. Secondly, we have to give a rotavirus vaccine. Rotavirus vaccine is again is an oral vaccine, which we have to give along with that. Then there is a pneumococcal vaccine. Various varieties of pneumococcal vaccines are available in the market, and that depends on the doctor to doctor and patient to patient and cost to cost. So these are the diseases. We protect 8 diseases at the age of 6 weeks. Then repeat this after 4 weeks. Then again repeat it after 4 weeks. 3 doses of these vaccines, what I'm talking about.
So there's another question from another parent, Monica Gupta, was asking, are there any potential side effects or reactions associated with the 6th week vaccination, and what should I be aware of?
Normally, as far as my experience is there, I have never noticed any serious side effect in any of the patients. Of course, sometimes a child may get a fever, maybe very mild, maybe around 99 or 100 degree Fahrenheit, not more than that. But I've never seen a child with a high fever or with convulsions or anything. And if we compare with the other vaccines like which cause fever, and in such age, at this age, if a high fever is there, child may pass into the convulsions. Seizure activity is also there with the painful vaccinations and the vaccines which cause a fever which of high grade. Then there is an emergency. The child has to be admitted in ICU for treatment of the seizures. While in this case, I have not seen a single case of seizures with this vaccine in my career. So, of course, I'll like to prefer that one should go for painless vaccine and the feverless vaccine after injection. Of course, during injections, and child, you may ask that if it's a painless vaccine. No, no, no. I don't say that is a painless vaccine. There is a pain is there only when we give it. Otherwise, afterward, there is no pain. There is no nodule formation. There is no fever. So always think that at times the patient says that if you call it a painless vaccine doesn't mean that we are pricking a child. Even if a small prick is there, child is going to have some pain. But during vaccination, little bit of pain is there. Of course, that is with all vaccines. That is all vaccines. So we should ignore that. So with the child would cry for any prick. And while with this child will cry, but later on, after injection, maybe after 5 minutes or 10 minutes, the baby is fine. So we should prefer this.
So, doctor, when it comes to vaccination, there are a lot of notions that parents hear about. So, I want to understand, why is it perceived as lesser painful as compared to other DTP vaccines, which causes more pain?
In fact, this is a acellular vaccine. Acellular component of DTP is there. While in other, it is a cellular component. It is an advanced technology and science that we are able to produce acellular component vaccines. Only good companies can make these vaccines. Only two companies are there, and out of them, this is the one which is only making a vaccine which is painless also and contains all the 6 antigens for protecting a baby. Yeah, we should use this vaccine. This has got an edge over all other vaccines.
Definitely. Now, Divya, who is a parent, is asking, क्या आप कॉम्बिनेशन वैक्सीन के फायदे के बारे में हमें बता सकते हैं? क्या 6th वीक के टीकाकरण के दौरान मेरे नवजात शिशु के लिए ये सुरक्षित और प्रभावी होगा? What would you like to answer?
हाँ, बिल्कुल। उसके लिए आंसर यही है कि आपका ये टीका 6 डिसीज के खिलाफ प्रभावी होगा, और यह प्रभाव उसको डिप्थीरिया, टेटनस, पर्ट्यूसिस मतलब काली खांसी, और हेपेटाइटिस बी एक तरह का जॉन्डिस, और पोलियो जो हर आदमी जानता है, और हीमोफिलस जो कि कान के इन्फेक्शन, निमोनिया और इन बीमारियों के खिलाफ आपके बच्चे को क्षमता देगा जिससे कि आपका बच्चा तंदुरुस्त रहेगा और बीमार नहीं होगा, और इससे बुखार नहीं होगा। अगर बुखार हो गया तो सारे घर के लिए प्रॉब्लम है, बच्चे के लिए तो पेन है ही है, बच्चे के लिए फीवर है ही है। कोई साइड इफेक्ट उसके अगर हो गए, हाई फीवर की वजह से कोई साइड इफेक्ट हो गए, वो तो है ही है उसके, जो इसमें नहीं है। इसलिए मैं ये रिकमेंड करूंगा कि भाई बिना बुखार होने वाली कॉम्बिनेशन वाली वैक्सीन लगानी चाहिए, जिससे कि एक इंजेक्शन के अंदर 6 तरह की डिसीजेस कवर हो रही हो। इसलिए मेरा कहना तो यही है कि भाई यही वैक्सीन लगाएं तो बेटर है। ऑफ कोर्स थोड़ा सा कॉस्ट में मैं मानता हूँ थोड़ा बहुत फर्क हो सकता है, लेकिन आप अगर कॉस्ट और एफिकेसी, मतलब कॉस्ट, उसकी कीमत और फायदे पे अगर आप जाएंगे तो आपको ये लगेगा कि ये कीमत फायदे से बहुत कम है। अगर आप 3 दिन घर पे बैठ गए, अगर पेरेंट्स को 3 दिन घर पे ऑफिस से छोड़ के घर पे बैठना पड़ेगा, उसके लिए उनको छुट्टी लेनी पड़ेगी। दूसरे बच्चे जो है, उस दूसरा बच्चे को जो प्रॉब्लम होगी वो तो अलग बात है। तो इसलिए क्या है, आपके वर्किंग आवर्स खत्म हो रहे हैं, आपको छुट्टी लेनी पड़ेगी 2 दिन 3 दिन के लिए, आपको बच्चे के साथ रहना ही पड़ेगा। अगर मदर फादर दोनों ही वर्किंग है तो फिर 3 दिन के लिए आप छुट्टी लेंगे, तो आप सोच सकते हैं कि फायदा कितना हुआ और नुकसान कितना हुआ। तो इसलिए अपना नुकसान और अपना फायदा देखिए। मैं ये नहीं कहता कि जिसमें फीवर आता है उसकी एफिकेसी कम होती है, मैं बिल्कुल नहीं कह रहा हूँ। अगर आपके अंदाजा ये लग रहा है कि मैं ये आपसे कहना चाह रहा हूँ कि भाई जो है उसमें फायदा नहीं होता और इससे फायदा होता है, ऐसी बात मत सोचिए आप। मैं फायदा उस बात का कह रहा हूँ कि ये लगाने से आपको बहुत सारी चीजों में फायदा होगा, जो आपके नुकसान से बहुत ज्यादा अच्छा है। आपकी कीमत के अलावा तो आपका क्या नुकसान है? कीमत मैं मान सकता हूँ कि थोड़ा हो सकता है, थोड़ा आगे पीछे फर्क हो, लेकिन इसलिए क्या ये वैक्सीन डेफिनेटली दूसरी वैक्सीन के हिसाब से 6 in 1 वाली वैक्सीन बेहतर है।
Definitely. When it comes to the parents, the new parents, they have a lot of doubt in their minds. So, another question is coming from a new parent named Ria Pathak, who is asking, my baby is of 1.5 months old. Is this vaccine available in government hospitals also? Can we take it from there?
This vaccine is not available in government hospital, any government hospital. It is only available in the private hospitals. Many private hospitals are providing this vaccine. It is not available in any medical store. Either doctors are allowed to keep this vaccine because cold chain has to be maintained. अगर वैक्सीन की कोल्ड चेन नहीं मेंटेन की गई तो फिर ये वैक्सीन बेकार है। कोई भी वैक्सीन बेकार है। पोलियो वैक्सीन जो ओरल पिलाई जाती है, अगर उसकी कोल्ड चेन मेंटेन नहीं की है तो वो भी बेकार है। इसलिए आप एक ट्रस्टेड जगह के ऊपर जाकर, जहां पर की cold chain maintain होती है। cold chain means the vaccine has to be kept in refrigerator at a particular temperature only, then this is there is the advantage to taking this vaccine। अदरवाइज तो अगर आपने सोचा कि मैं मेडिकल स्टोर से आपने वैक्सीन उठाई, बोला चलो किसी से लगवा लेते हैं, रास्ते में उसकी कोल्ड चेन खत्म हो गई तो वैक्सीन बेकार हो गई। तो मेरी ये राय है कि आप जो है वैक्सीन जब भी लगवाएं, एक ऑथेंटिकेटेड हॉस्पिटल, ऑथेंटिकेटेड क्लिनिक, ऑथेंटिकेटेड डॉक्टर के यहाँ जाके लगवाएं और ये चेक करें कि भाई वो वैक्सीन आपके सामने खोल रहा है कि नहीं। दूसरी चीज, अभी वैक्सीन के ऊपर एक स्टिकर लगा होता है, एवरी वैक्सीन हैज गॉट अ स्टिकर ऑन इट which tells the date of expiry, date of manufacturing. You must tell your doctor, you must tell the health worker, whosoever is giving you the vaccine, please put this sticker on my file so that I know that this proper vaccine has been given at a proper time, at a proper place. So that is the thing, one should always be careful. So मैं यही कहूंगा कि आप जब भी वैक्सीन लें तो एक ऑथेंटिकेटेड जगह पे लगवाएं।
So, ensuring that the parents are getting the correct vaccines is also very much important, as you're saying,
Yeah.
doctor.
Yes, yes.
So, another parent named Haritha is asking, how does the 6th week vaccination contribute to my baby's overall immune system development?
In overall immune system, all vaccines, whichever vaccine is there, any vaccine, I'm not talking about this vaccine or any other vaccine, I'm talking about any vaccine. What is the role of vaccine? When baby takes this vaccine, in reaction to this, baby's body that makes antibodies against particular disease. These vaccines like diphtheria, tetanus, pertussis, or whatsoever vaccine are there, they are live vaccines also. They are attenuated viral vaccines or attenuated bacterial vaccines. Attenuated means they cannot cause a disease, but they can give protection. So these are attenuated vaccines which are taken by a baby will get the protection but will not suffer from the disease. And you may ask that you are giving live polio vaccine, injectable polio vaccine. Of course, this is a live vaccine, but can it cause poliomyelitis? No, it cannot cause, because the polio virus is attenuated in this vaccine. So once you attenuate a vaccine, it means we are giving a protection to the child, not the disease. Similarly, other vaccines also, diphtheria, tetanus, pertussis, and all that, they all are attenuated vaccines, and these attenuated vaccine will produce antibodies in the baby, but will not cause a disease. So rest assured that कि भाई हमने लगा दिया, vaccine लगाया, even the BCG vaccine, whatever vaccine, other vaccines, BCG vaccine again a live vaccine. Of course, we are injecting tuberculosis vaccine, but it does not cause tuberculosis. It will give protection against tuberculosis. Similarly, talking about various other diseases like typhoid, also again attenuated, or the conjugate vaccine, they are there, live or non-live, whatever it may be, but they will not cause disease. They will give protection, but they will not cause disease. So rest assured that you have to have a faith in developing science. You have to have a faith in advanced studies. You have to have a faith in new and good vaccines in combination, which gives a less pain to your child. And of course, less loss of manpower and less trouble to the parents and grandparents and so on.
Sure. Another parent named Gauri has a question. Is there a specific schedule or timeline for follow up vaccinations after the sixth week? And what vaccines will be administered in subsequent appointments?
Yes. Then various agencies and various associations have produced their vaccination charts and schedules. Government of India and private and European and American, so many agencies, American Pediatric Association, all have got a different. But what we should follow is that I'll say that we should protect our baby from the diseases which are common in our surroundings. Whether the vaccine is available in the government sector or not, we are not bothered. First of all, to start with, at birth, we give hepatitis B vaccine, we give BCG, and oral polio vaccine. These three diseases are protected. Vaccines are given from birth to 1 week of the age. Earlier, the better. Then, at 1.5 months of age, we give diphtheria, tetanus, pertussis, hepatitis B, poliomyelitis, Haemophilus influenzae, this six in one vaccine, plus rotavirus vaccine against diarrhea, then pneumococcal vaccine against pneumonia at the age of 1.5 months. Then after 6 weeks, you take the baby again to a health center or a doctor at 10 weeks. At 10 weeks, again, the same routine, these same three vaccines, like two shots. One shot is of hexaxin or 6-in-1 vaccine, one rotavirus, oral polio vaccine, and one pneumococcal vaccine. Then the third, again, at the age of 14 weeks, again the same schedule is repeated. Again, the same vaccines are given. After completing this schedule, your child needs to go to a doctor for next vaccination at the age of 6 months. At 6 months, flu vaccine is given. Flu vaccine protects against the common flu, little bit of protection against the corona also, little bit. No, I don't say that. It gives a complete protection against the corona vaccine. That vaccine is different. Even that vaccine is not available for children right now, for small babies. Then at 7 months, again, you have to give a influenza vaccine, flu vaccine. Then after 6 months, the vaccine required next is a meningococcal vaccine. Meningococcal vaccine has to be taken between 6 months to 9 months in between first dose. And after 6 months of injecting this first dose, one has to take second dose of meningococcal vaccine. In between, at the age of 9 months, we give MMR vaccine, measles, mumps, and rubella vaccine, 3-in-1 vaccine. It is available. Then in government, if we talk of a government schedule, they don't give MMR vaccine. They give MR vaccine, measles and rubella vaccine. Mumps component is not there in their vaccine. So always prefer to go for MMR. Mumps is again a disease. Mumps is like a जिसको आपने देखा होगा गलफेड़. So that is called as a mumps vaccine. It may come out with many side effects. And then after that, we give one shot of typhoid vaccine. These days, in the latest schedule, one dose of typhoid vaccine, if it is taken, gives a protection nearly lifelong. Then, at the age of 1 year, one has to take a vaccine against hepatitis A. Hepatitis A, that is a jaundice, जो common language में बोले पीलिया हो गया. This pília is an infective pília or infective jaundice, and this is a food and waterborne disease. And the vaccine is available for against hepatitis A. It is only available in a private sector or in a distinguished hospitals and distinguished doctors only. And the second dose is to be repeated after 6 months. So that gives a protection against jaundice. Second dose. Don't get confused by the hepatitis B. Hepatitis B is a different disease. Hepatitis A is the commonest disease in India, and in 13 by the age of 13 years, practically every child is infected with hepatitis A. Then coming to the age, at the age of 15 months, we give again MMR vaccine one shot. Then the pending the meningococcal vaccine is to be taken. Then at the age of 18 months, we give a pentaxim, penta dose, and not the hexaxim. We give pentaxim, which contains the 5 components in it. Again, it is a fever-free vaccine, and which then after this we give at the age of 4.5 years. At 4.5 years, then again we give a DPT or DTAP. Again, like a tetraxin type, that vaccine is available. We give at that age. And at the age of, then again, after this 4.5 years of age, you give switch out directly to the 10 years of age, where we give DT vaccine, diphtheria DTAP. Again, a acellular vaccine is available for at the age of 10 years. Then at the age of 10 years, again a vaccine for females, girls particularly in India. While it is given world over, males and females both are given. This is the papilloma virus vaccine, which this vaccine protects against the cervical cancer vaccine. Cervical lung, uterus cervical cancer, not this neck cervical. So that vaccine is available in India, very freely available. That has to be taken at the age of 10 years. 2 doses are given. Then at the age of 16 years, tetanus vaccine is given. So that completes a cycle for practically all diseases, whichever are prevalent in right now in India. Then there is one more vaccine of this for the people who go abroad, a yellow fever vaccine that is also available. One can also take. Then there is the Japanese encephalitis. That vaccine is also there. One shot can be given at the age of 6 to 8 months of age, and this is particularly for the children or for the people who are living in the northern eastern part of India. So this is the complete schedule against these all diseases. I think everybody should take all these vaccines so that you are protected against dreadful diseases.
Definitely. So, also, doctor, we as mothers probably are always more concerned about the side effects. So, why don't you release our stress by sharing a little bit more information so that our doubts are completely clear?
Yes, side effect. There is nothing in this world which does not have side effect. Excessive water has a side effect. Excessive tea has a side effect. Excessive sleep has a side effect. Excessive awakening is also side effect. Side effect is not a bad effect. First thing one should always remember in life: if you look for the side effect, you will not be able to go anywhere. You cannot lead your life if you think that there is not side effect. There is, of course, you are walking on the road. That is a side effect. Someone might hit you. Cycle chala rahe ho, gir gaya, that is a side effect. But do you think that this is a bad effect? No. Vaccines can have a side effect. Any vaccine can have a side effect. Any vaccine. Like ranging from the oral polio vaccine, you think that this is a very safe vaccine by 2 drop pila di. No, it has got a side effect, but it should not have a bad effect. Bad effect means if with polio vaccine one gets polio, it is a very rare thing, very rare. It does not happen normally. Then if you give a DTP or DPT vaccine, you get diphtheria. Of course, that is bad effect. There usually the bad effects. Usually, bad effects are not there. Side effects can be there. People who claim that there can never be a fever with this vaccine, no. Any vaccine can cause fever. Even polio drops can cause fever. Anything can cause fever. BCG vaccine, hepatitis B, conjugate hemophilus vaccine, whatever vaccine, they can cause some side effect, but side effects are not bad effects. One should not have bad effect, may have side effect, which are curable and treatable for lifelong.
So thank you for clearing this doubt, doctor, that not all side effects are the bad effects. So that brings me to my another question. Some parents think that if a vaccine does not produce any kind of fever or any bit of a reaction, then it may not be responding well. So what would you like to say about this? How true is that?
That I would just say that how happy you are when your child has a fever. How happy. कितना खुश हो गए कि मेरे बच्चे को बुखार हो गया, बहुत अच्छी बात है. नो, कोई अच्छी बात नहीं है फीवर होना. कोई जरूरी है क्या फीवर हो उसको? आपको चाहे वैक्सीन इज ए सेलुलर वैक्सीन और सेलुलर वैक्सीन, you don't compare, you cannot compare between, both are good. I don't say that the vaccine with the fever which causes fever will not give a protection. No, I have never said so. And vaccine which does not cause fever is equally good. Protection is same. Don't think that the vaccine which causes fever will give a better protection to your baby. No, never. अगर ये ऐसा होता तो सारे वर्ल्ड के अंदर पेनलेस और फीवर फ्री वैक्सीन कहीं पे भी नहीं लगाई जाती. Go to US, go to America, go to any of the part of the Europe. These vaccines are only used which are these combined vaccines and conjugate vaccines. They are being used. It's a research is there. It's not ki by some. This is a myth that if my child does not have fever, it means the vaccine is not effective. नहीं भाई, ऐसे थोड़ी होता है कोई. अगर ऐसे होगा तो फिर there is no use of these vaccines. It is never there. So don't put anything in your mind that my child should have fever. मुझे तो समझ नहीं आता भाई, अगर आपके बच्चे को बुखार हो गया, 2-3 दिन बुखार में रहा, आप भी सब छोड़ छाड़ के बैठे हो बच्चे के साथ, कितनी अच्छी बात. आई डोंट थिंक दिस गुड. और इसका कोई फायदा नहीं है. आप ये सोचो कि इससे कोई बहुत अच्छी वैक्सीन, ये बहुत बढ़िया प्रोटेक्शन मिल गया, ऐसा कुछ नहीं है. लिटरेचर में कहीं भी नहीं लिखा हुआ, पूरी स्टडीज में कहीं भी नहीं लिखा हुआ कि वो वैक्सीन जो फीवर कॉज करती हैं और वो वैक्सीन जो फीवर नहीं कॉज करती हैं उनके प्रोटेक्शन में कोई फर्क होता हो. ऐसा कहीं भी नहीं लिखा हुआ, किसी भी लिटरेचर में नहीं लिखा हुआ. इसलिए इस मिथ को अपने दिमाग से आप हटा दीजिए कि भाई जिससे बुखार होगा वो अच्छी वैक्सीन है. नो एंड नेवर. सो ऑलवेज गो फॉर ए गुड वैक्सीन. अदरवाइज ये वैक्सीन डेवलप भी क्यों होंगी? अगर उसी से काम चल रहा होता तो बाकी नई वैक्सीन क्यों डेवलप होंगी? वही बनाते रहते भाई, वही चलते रहते. नो, ऑलवेज वी शुड लुक फॉर ए बेटर थिंग्स. जो अच्छा होगा वही मार्केट में टिकेगा, वही पेशेंट एक्सेप्ट करेगा. हमारे यहाँ तो सारे पेशेंट एक्सेप्ट करते हैं भाई, जो भी आता है उसे फ्री, बस फीवर फ्री वाली लगाइएगा, फीवर फ्री वाली लगाइएगा, पेन फ्री वाली लगाइएगा. मेरे पेशेंट्स ऐसे हैं. एंड आई थिंक मोस्ट ऑफ द डॉक्टर्स के साथ ऐसे ही है. पेरेंट आते कहते हैं सब फीवर फ्री वैक्सीन ही लगाइएगा, तो बुखार तो नहीं होगा, बुखार तो नहीं होगा. नाउ द टाइम इज चेंजिंग, थिंग्स हैव चेंज, वी शुड आल्सो चेंज आवरसेल्व्स. एक पुरानी थॉट को लेके अपने को नहीं बैठे रहना है. इसलिए जो है we should go for better vaccines.
Definitely, and I'm quite sure that all parents try to, get the best thing available for their child. And thank you for clearing this doubt that not all vaccines would show the reaction. So that brings me to another question, which a parent Kirti is asking: what signs of a possible adverse reaction or allergy should I monitor for after the 6th week vaccination? What would you say?
After 6 weeks, okay. Well, after 6 week vaccination, of course, about the painful vaccination, we should talk about first about the painful vaccination. Painful vaccination, or which is a cellular vaccine that will cause fever, that will form a lump at the site of injection, that child will not allow you to touch, child will not be able to move itself, high grade of fever is there. You should look for the abnormal things like seizures, convulsions, they can be there. Then sometimes patient can pass into the encephalitis sort of a thing also can pass, of course, because certain viral fever, viral vaccine can cause that. Whenever your child has a, if you take, you have taken any vaccine, whatever, I'm not talking about any other vaccine, कोई भी वैक्सीन आपने लगाई है तो you should look for, first thing is for the fever, for abnormal signs, for abnormal movements of the body, for unconsciousness, for convulsions or jitteriness. If these things are, and if your child is not taking feeds after that taking a vaccine, child is not able to take milk, or then only these are the things to be watched for any vaccines. If normally these symptoms are not there with the vaccine, which are fever free vaccines, or you may call it acellular component vaccines, or it doesn't matter whether it is a monovalent, bivalent, or trivalent, or six valent, but so you should watch your baby for any abnormal thing, and you should immediately report to your doctor that my child is having this problem, that is not taking feeds, he is showing abnormal movements, he is not able to sleep, and he is making faces, grimaces. Sometimes the convulsion can be in form of abnormal face movements, or sometimes these jerky movements can be there. And if these things are there, you should immediately report to the doctor. Normally with safe vaccines this does not happen, but can happen with the other vaccines, and many vaccines nearly. And these are the only thing. If some problem in the movement of the limbs, some movement of the limbs, suppose arm is not moving, or some legs are not moving, or child has become unconscious, so these things are to be kept in mind with any vaccines. Normally good vaccines don't cause it, I've never seen, but other vaccines can cause it. And we always explain to the patient that you should be careful about your baby. If some problems are there, then please do report immediately and take care.
Definitely. So, we spoke about this vaccine, doctor. I wish to understand, are there any side effects of these lesser painful DTP vaccines as well?
I was asking about the painful vaccine.
These
Nahi,
lesser painful DTP vaccines we are talking.
less painful vaccines. No, less
So, are
painful what
there
we are
any side
discussing.
effects of these lesser painful DTP vaccines?
Painful vaccine, these are the all side effects like high fever, nodule at the site of injection. Then can there can be seizures, there can convulsions. That's the only thing that there's already I've told you about that. These are the things with the painful vaccines and which cause fever. Febrile vaccines, these are called as febrile vaccines. They cause fever, high grade fever, poor feeding, abnormal movements, and all these sort of uprolling of eyeballs, and unconsciousness, and these sort of things. They can cause painful vaccine. While with the other vaccines, usually this is not seen.
So, doctor, are other countries also using these and this less painful one vaccine to protect against six diseases?
Yes, yes, yes. I mentioned you about this. That all vaccines, all advanced countries like UK, US, Canada, Europe, most of the Europe, they all are using these vaccines only. The painful vaccines are not available there. They are not available at all. And government, of course, in Indian government, it is they are only advocating about the painful vaccine because they are cheaper. We are too many. Population wise, we are too many. We cannot afford all vaccines, all painless vaccines, all these vaccines to everybody. So this is limited to the people who are naturally of a little affordable class. This cannot be given free because it is not available on the free, on free to the doctor or any healthcare taker or any hospital. While in I've seen in Canada and I've seen in UK and US also, there are camps And the same vaccines, these are the vaccines I had seen giving Hexaxin and even Prevnar and these vaccines, all then rotavirus vaccine free of charge. And I have seen the kiosk in malls giving free vaccination from the government side. But here we are not getting. And I think we would take many years to come to that level. And before that, we should protect our child against all dreadful diseases by better vaccines, which are available in the West, which are being given in the West and developed countries. Let us also we become developed country. We are developing, we should develop. And once we are developed, we will have to accept these vaccines only. Even parents should, if these vaccines are freely available, I'm sure that you will opt this vaccine only. If you go to a government hospital and you say, no, I will give you give me a painless or this feverless this vaccine, or and if he says where you take a painless vaccine, you take a painful vaccine. What will you choose? You'll choose painless vaccine. You will choose painless vaccine, but if it is free, but it is not. So, if you can afford, of course, if you can afford, then we should go for better vaccines which are available. And if it is within your reach, you should grab it and protect your child with the best possible vaccine. Anybody which any parent would want that their child should go to a better school. Anybody wants that I should have a better car. Anybody wants that we should have a better mobile. So why not to have a better vaccine? So I think we should go for a better things. So there should no comparison between the two vaccines. And so if you can afford, you should go to a better vaccines. Like as you go for a better car, like you go for a better restaurant, like you go for a better tea, so many things. So इसलिए बेटर अगर आप अफोर्ड करते हैं आपको बेटर की तरफ ही जाना चाहिए और मोर साइंटिफिक इट इज मोर साइंटिफिक अबव ऑल ऐसा नहीं है कि भाई ये तो महंगा है तो अच्छा है नो 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 इट्स नॉट लाइक दैट आप इट इज
Sure.
रिसर्च की वजह से आपका बेटर है वैक्सीन जी
Definitely. So, Dr. Hargovind Bhasin, I would really like to thank you for joining us and sharing so many information about one vaccine that would protect against six diseases and what all a parent must know. So, I would request you, for all the parents who have joined us right now, if you could please recap about one vaccine to protect against six diseases and what a parent must know before the sixth week vaccination for their newborn baby.
so again I'm again advocating recapping this vaccine at the 6 weeks is better vaccine available. We should go for a better vaccine which does not cause fever. It does not produce a lump on the body, on thigh, wherever the vaccine is given. So child is not deprived of massage for few days, 4, 5, 6 days. And this nodule may persist for a time for a month or 1.5 months sometimes. So baby is in trouble. If baby is in trouble, mother is in trouble. Mother is in trouble, father is in trouble. So all are in trouble. So better to avoid trouble and take a better vaccine. Available है, easily मिलती है, कोई प्रॉब्लम नहीं है उसमें. Go to a proper place and get your child vaccinated at 6 weeks. At 6 weeks, 8 diseases are protected with 2 shots and one oral vaccine. Oral vaccine is the rotavirus vaccine, which is against diarrhea. The pneumococcal vaccine, again an injectable vaccine that usually doesn't cause fever. Then a 6-in-1 vaccine, which about it takes care of diphtheria, tetanus, pertussis, polio, hemophilus influenzae, and so on. So go for a better vaccine at the age of 6 weeks, 10 weeks, 14 weeks, and then pentaxin vaccine at the age of 18 months. Then at the age of 5 years, 3-in-1 vaccines. So you should go for a better vaccines.
Sure. Thank you so much, Doctor, once again for sharing this peaceful information with us and clearing all the misconceptions that the parents had.
Thank you. Thank you. Yes,
And thank you, parents.
I tried my best, at my level best to remove all your queries and the parents' queries or anybody's queries rather about vaccines, whether painful or non-painful or whatever, and what are the ages where which diseases are to be protected. I tried my best to clear it. and hope we'll see you later.
And thank you, parents, for joining. And I hope this was a wonderful session. And I hope this was really helpful to you all. Thank you.
Thanks very much for your